So a few years ago, 11, 12, 13 years ago, something like that, it's all starting to blur together. A group of Harvard researchers went into emergency rooms in the United States because what they wanted to do was figure out if women were being systematically undertreated in emergency rooms. So they created 3 sets of fake patients. They weren't really fake patients, they got real patients and they just deleted the identifying material. So they had x-rays, all the data that you would need to diagnose the patient. And one of the sets didn't have gender on it, one of the sets didn't have race on it, and then the other set didn't have anything race or gender on it, right? And they went into emergency rooms and they asked emergency room doctors on their breaks, do you mind looking at these patients and then diagnosing them and then coming up with a treatment plan? And so the doctors did. And the researchers discovered that women were undertreated in emergency rooms. They discovered that, as a general rule, if a man complained about pain, that man was going to get painkiller. But a woman might get a smaller dose, or might not even get a dose, because the doctors were just assuming that the woman was complaining extra, but a man is tough. And I'm really confused about that because I thought it would have been the other way around. But anyway, childbirth? Did I miss something? I don't even know how you could get there. Like, I feel like a person who's completely oblivious to how our species functions would land on that answer. But okay, that wasn't the real shocker though. The real shocker was the role that race played. Race, and the darker your skin color was literally deadly, because they had the control group. The control group didn't have race or gender on it, so they knew what the answer should have been. And doctors systematically underdiagnosed and then undertreated people based on skin color. But you have to remember something about the United States. It's complicated, it's fun. So the United States is 58% white, but the doctors are only about 48% white. So this systematic undertreatment of brown and black people wasn't just being conducted by white doctors, it was being conducted by brown and black doctors too. And so the researchers were shocked, didn't expect this. They compiled the data, and even with everything I've told you so far, that wasn't the real discovery. The real discovery is what happened next. They went back to the doctors and showed them the data. So they could show the doctor, this is how you underdiagnose this person. They've got the results. And these MDs, emergency room doctors, my mother was a nurse, and she loved to invite doctors to our house for parties. So as a kid, I used to hear stories, and my favorite doctors to talk to were the emergency room doctors. The crazy stuff they would say, right? When I think of emergency room doctors, I'm thinking of they're like Navy pilots. What kind of maniac tries to land a plane on a runway that's too short, that's moving? You know what I mean? Like, I feel like emergency room doctors are like that. What kind of maniac tries to treat a patient and they don't have enough time? Anyway, so they showed the emergency room doctors the data, and a bunch of them burst into tears and started crying. And they were saying, I'm not a racist, I'm not a racist, I'm not a racist. But they're looking at the data, and it's of course one of those moments where there's too much evidence pointing in the direction that apparently they are, even though they themselves are brown and black too. Right? It was also the white doctors, obviously, even the brown and black.
Do you think it's possible for someone to be biased without even realizing it? Have you ever caught yourself doing it?